Hi all, this is Jenny Gallagher with Joyful Heart Healthcare. We are going to learn how to give an injection into a muscle today. I recently sent patients some injectables. So I was going to send them a YouTube video, and when I looked online, all of them had faulty methods. So I'm going to make my own video so my patients can see my preferred technique. So what we're going to do is we're going to give a B12 injection to myself. So the first thing we're going to need is our medicine. You need to understand your prescription. So if you're using 1 meal or half a meal or 1.5, whatever your amount is, you follow the directions on your label carefully. We're going to start with a 3 ml syringe, an alcohol pad for the bottle of medicine, an alcohol pad for my leg, which is where we're going to inject today. So the first thing we're going to do is we're going to open our alcohol pad and make sure that the metal center has been removed from your medicine. A brand new vial will have a metal little cap there. You pop that off so that you see the little rubber center. So we're going to press into that and alcohol that off really well. We're going to let that air dry. We don't fan it, okay? We let things air dry. We don't fan our skin either. You let things air dry. We want the alcohol to dry completely so that it stings less. When the needle punctures the skin, if there's alcohol that's wet sitting there, it'll sting worse. So we don't want that. So we want to get rid of that. While we're waiting for the alcohol to dry on my bottle, I am going to change our video to my leg so you can see me work here. Okay, so we're going to inject a little spot right about here on my thigh. Intramuscular medicines go into the muscle, so you can use the top part of your thigh or the side part of your thigh. You could also use your shoulder. I'll show y'all that in just a minute. So we're going to alcohol a little spot right here. We're going to let that dry. So right here is where I've alcoholed. And so I'm making note of this spot I alcoholed off. I'm going to take my syringe, open it up. Before I pull it out of the package, I want to twist to make sure that the syringe is attached to the needle part. I have opened packages before, and when I pull it out, the needle falls to the floor, like it's not secured. So you want to make sure that is secured before opening. You can do it now as well, but if it's loose and falls off at the beginning, then you got to start all over. So we're going to take our cap off of the needle, and we're going to pull a little bit of air into our syringe. That's about 1 ml. That's what I'm taking out of the medicine bottle. So I want to put in that same amount of air. Okay. So now I'm going to take and press the needle into the little gray center part. I'm going to inject air, and then I'm going to pull out the 1 milliliter of medicine. So you can see real close that I've got my 1 ml of medicine in. There is a little air bubble. I'll show you my trick for that. So keeping our fingers away from the needle, I pull a little more air down to completely clear the needle and attachment, and then I push all of it very slowly until I see a tiny drop of medicine come out the tip. See, there's the medicine. So now there's no air. You can flick it a little bit. You have to be careful with that. If you're not holding it securely, you can flick the whole syringe right out of your hand. So it's not something I recommend. I prefer to draw the air back out of the pathway and then inject till I see that little dot of medicine at the top. So we've alcoholed our leg. We have our medicine and we are ready to inject. So my spot was right here that I alcoholed. Some people prefer to keep one hand here if they're giving the medicine while someone helps them draw it up. Or you could draw it up ahead of time. And that way, once your alcohol is dry, you can inject. So a couple things, a couple tricks I want to teach you. One is if you use your fingernails to press into the sides of your skin, you can sort of deflect the injection sting, the pain when your needle punctures the skin. Your brain is sensing all of these different impulses. I'm pressing with my thumb and my fingernails into skin nearby so that when my needle punctures the skin, there's less pain noticed. So I'm pressing and then I inject and then I remove the needle. Okay? Quick and simple. Very easy process. Trying to move my camera back up here. I need a camera assistant. So that's how to give yourself an injection. If you have someone to give yourself the injection and you don't have to give it to yourself like I did, you could use your deltoid. Many people, when you go to clinics, the nurses will inject your deltoid as an intramuscular or IM injection, and that's appropriate as well. But it's hard to do this yourself because if you're holding a syringe, whoops, I just splattered on my camera. So if you're holding that here, it's difficult to get the right angle and it can be more painful. So it's not something I recommend you do for yourself. But if you do have a family member who's willing to provide you with the injection, they can use your shoulder. So to find the right place in this muscle, it's not down here like you see on TV shows. You want to get up here and find the shoulder bone and put your fingers, 2 fingers. Some people say 3, and that's okay. That's only about a ½ inch difference. But you want the muscle, the medicine going in the biggest part of the muscle, which is right here. And so we find the bone, we put 2 or 3 fingers, and then the medicine goes right here. And so you can use your fingernail to press a little dot. You can even use a pin to mark the spot. That's what some people will do. They'll put a pin mark there so it keeps it sort of close to where you want to give the shot. We used to use the glutes a lot, the gluteus muscles in your behind. We don't do that much anymore because of injury to the sciatic nerve that runs down through your behind. So we don't use those shot places anymore, okay? Hopefully this will help you give yourself painless shots when you need them. I'm Jenny Gallagher with Joyful Heart Healthcare. Find me on Facebook.